Hi, it's me again, the person who isn't a doctor on TV, but I do play one in real life. And I call this episode, Don't Pull the Plug on Grandma. This is Grandma. My grandma's name was Bubba for reasons unknown to me, but it was kind of a cute name for a little old lady who was maybe 5 feet tall and 80 pounds. So, what I want to talk to you about today is death panels. Remember those? That was the big phrase back in like 2008 or 2009. And it was when they were talking about rationing care. So, first of all, let's start with the knowledge that in America, 16% of our GDP goes towards healthcare. That's huge. And 25% of that dollar amount, which in the most recent estimate was $3.2 trillion. I tried to do the math on my calculator. It doesn't have enough spaces for all the zeros. So I had to do it by hand. So if I got my math wrong, please let me know that I got it wrong, but I don't think I did. At any rate, 25% of our healthcare dollars are spent in the last year of life. That is 25%, or roughly $8 billion gets spent in the last year of life when we're trying heroic measures to save people's lives because nobody has discussed with their loved ones what they want to have happen at the end of life. There is a town that is well known in the healthcare industry for their extreme success in reducing healthcare expenditures in their community. And the reason why is because 96% of the population of this town, which is La Crosse, Wisconsin, has end-of-life directives or advanced care directives or living wills. They kind of fall under a bunch of different names. But what it means is that you've had a conversation with your doctor and you have talked to your doctor about what you'd like to have the end of your life look like. And you don't have to have these conversations when you're facing a terminal illness. You can have these conversations starting when you're 20 years old, because we know that bad things happen even to 20-year-olds. And it's difficult for family members when they're faced with seeing grandma in the ICU or their youngster in the ICU. And not knowing what the wishes of that person who's terminally ill would have been for themselves. It's extremely distressing for people to look at their loved ones and to just want desperately for their loved one to be back to the way they were before the accident or before the illness. I totally get that. It's heart-wrenching. It truly is. But we can help them by having conversations with our loved ones before we ever get to that instance. Because when you're under emotional distress, you can't think clearly. You can't process the information that the doctor is giving you. It's just blah, 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 ginger, blah, blah, blah. You can't hear it. All you know is you want your mom to get better, or your baby to get better, or your grandma to get better. And you can't make rational decisions. But when you take the decision out of the extreme and you put it at every single patient encounter that somebody has along their healthcare life, if you will, then they have the opportunity to talk about what's going to happen at the end of life. If you polled 100 doctors and asked them, at the end of your life, do you want us to intubate you, put a breathing tube in your throat, put a tracheotomy in, have a feeding tube in you? If you're incontinent, do you want to live in diapers? If you're unable to swallow, do you want us to feed you through a tube? And I promise you, 100 doctors will say, hell no, don't do it. I wouldn't do that to my dog. But that's what we do to our loved ones because we haven't made those decisions. And what La Crosse, Wisconsin did was they got proactive and they had these conversations at every patient interaction, whether it's at your OBGYN's office or your internal medicine doctor's office or your allergists or your surgeons, at the preoperative visit when you're filling out insurance forms. The nurse talks to you in pre-op. Multiple times along the way, you're talking to people. And initially they're resistant, but over time they become aware that their mortality is 100%, as is all of ours. We're all going to die. And the easiest way for us to cut back on healthcare expenditures is to have these end-of-life discussions before we actually get to the end of life. Now, if you think about it, it's kind of crazy for a doctor to be telling you that we should do this and that we should pay for it, because you know what? It loses money. If we're actually proposing a program where we talk to you so that we don't get to bill you for a lot of expensive procedures. We get paid for doing things. We get paid for doing procedures. And so if we get you to sign this advanced directive so that we don't give you all that expensive intensive care at the end of your life that often is fruitless anyway, then who stands to lose money? The insurance companies actually save money, right? They're not laying out money to take care of this patient. Who else saves money? Medicare saves money, because a lot of elderly people that wind up in the hospital are on Medicare. Who else saves money? Medicaid. Remember how they're talking about the Senate healthcare bill right now and how they're going to make deep cuts to Medicaid? If we did this one thing, if we did it across the board, we could save billions of dollars. I'm not exaggerating. Who else saves money? You. Because your premiums go down and you also don't spend all that money at the end of life, right? Who stands to lose? Hospitals. They don't make any money if they don't get to put you in the hospital and put a breathing tube in your throat and do surgery on you. Doctors, people like me, lose money. Who else? Drug companies lose money. Others would be like medical supply manufacturers, people who make the breathing tubes, right? But it's crazy that we do not get reimbursed for sitting down and having end-of-life discussions. You would think if the insurance companies and the government was truly interested in saving Medicare and Medicaid, they would pay us to have these conversations. And if you ask, why am I proposing that we do this? Because doesn't it kind of shoot me in the foot? It means I don't make as much money. Because it's the right thing to do. Because if you saw what I see in the ICU every single day, you wouldn't want it for yourself either. So I encourage each and every one of you to initiate these conversations with your doctor, with your nurses, with any healthcare provider that you encounter, and draft a directive, an advanced directive, and talk to your family members about it. Tell them what you want for yourself at the end of life, because it will make your departure much less agonizing for you, and especially for your family members who have to wonder if they're doing the right thing and will be haunted by it forever. That's it for tonight. Let me know what you think.